A warm greeting to all. I'm Pauline Sheela Priya, Assistant Professor, Faculty of Sri Balaji College of Nursing, Bharat Institute of Higher Education and Research, Chennai. So today we are going to discuss about interesting topic in genetics, that is genetic counseling. So genetics is the study of genes, genetic variation and heredity in living organisms. It is generally considered a field of biology, but it intersects frequently with many of the life sciences and is strongly linked with the study of information systems. So introduction about counseling. So counseling is a process of communicating between two or more persons who meet to solve a problem, resource occurs, or take decision on various matters. It is not a one-way process wherein the counseling tells the client what to do, nor it's a forum for presentation of the counselor's values. So what is genetic counseling? So genetic counseling process follows the basic characteristics of a counseling process. It is undertaken with families confronted with genetic and inherited disorders. Sheldon Reed proposed the terminology genetic counseling in the year 1947. So genetic counseling is the process of checking family medical history and medical records. Based on the records, ordering some genetic test. Based on the test, evaluating the results of the test and records, and helping the parents to understand and reach decisions about what to do next. So the definition of genetic counseling. The American Society of Human Genetics define genetic counseling as a communication process which deals with human problems associated with the occurrence or the risk of occurrence of a genetic disorder in a family. The WHO, the World Health Organization, defines genetic counseling is the process through which knowledge about the genetic aspects of illnesses is shared by trained professionals with those who are at an increased risk of either having a heritable disorder or of passing it on to the unborn offspring. The purpose of genetic counseling. The main purpose is to provide concrete, accurate information about inherited disorders, reassure the people who are concerned that the child may inherit a particular disorder, that the disorder will not occur. Allow people who are affected by inherited disease to make informed choice about future reproduction. Educate people about inherited disorder and the process of inheritance. To provide and support by skilled healthcare professionals to the people who are affected by genetic disorders. The indications for genetic counseling. So when to seek a genetic counseling? If a standard prenatal screening test, such as alpha fetoprotein test, yields an abnormal result, and amino synthesis yields an unexpected results, such as chromosomal defect in the unborn baby, either parent or close relative has an inheritance disease or birth defect, either parents already has children with birth defect or genetic disorders. The mother has had 2 or more miscarriage or a baby dies in infancy. The mother is 35 years of age or over, or the partner is blood relatives. So these are certain indications for genetic counseling. So who are genetic counselors? So he must be a postgraduate health professionals with a graduate diploma or master's in genetic counseling. He may be expertise in the areas of medical genetics and counseling, identify the families at risk and investigates the problems present in the family, interpret information about the disorder, analyze the inheritance patterns and risk of reoccurrence, and review the available option with the family. Then the genetic counselor serve as an educator and resource people for other healthcare professionals and for general public. He must work in administration capacity, a team of physician, nurse, and social worker who undergone special training in genetic counseling. Many engage themselves in research activities related to the field of medical genetics and genetic counseling. So what is the role of a genetic counselor? The genetic counselors provide genetic information. It is their counseling skills, including their ability to empathetically connect with their patients, that leads to demands for their skills. A good genetic counselor have many strengths. They make their clients' best interest their foremost priority and are cleanly attuned to complex professional and ethical challenges. So a genetic counselor uses non-directive counseling method to provide the best service to those who need them. To develop a mutual relationship with the client, to understand her or him, to relieve any psychological distress, promote a sense of control, and help find solution to specific problems. So steps of genetic counseling. So an accurate diagnosis of a particular disorder. To complete an accurate diagnosis, the following procedure should be followed, which was categorized under 5 headings. First one is the history collection, pedigree charting. Third one is estimation of risk and transmitting the information and management. So in history, so what all the histories has to be collected from the client. So a proper record of the history of the patient is necessary. This includes both present and relevant past history. So family history includes siblings and other relatives also. So kindly note if there is any other person in the family with a similar problem. Then obstetrical history must include exposure to tetrogens, drugs, and X-rays in pregnancy, which may harm the fetus. Then history of abortion or stillbirth, if any, that also should be recorded. Then enquiry should be made about consanguinity, because as it increases the risk, especially in autosomal recessive disorders. The second step is, after collecting the history, is pedigree charting. So pedigree charts are diagrams that show the phenotypes and or genotypes for a particular organism and its ancestors. So while commonly used in human families to track the genetic diseases, they can be used for any species and any inherited trait. So genetics use a standardized set of symbols to represent an individual's sex, family relationships, and phenotype. So these diagrams are used to determine the mode of inheritance of particular disease or trait, and to predict the probability of its appearance among the offspring. So pedigree analysis is therefore an important tool in both basic research and genetic counseling. So each pedigree chart represents all of the available information about the inheritance of a single trait. It is most often a disease within a family. The pedigree chart is therefore drawn using factual information, but there is always some possibility of errors in this information, especially when relying on family members, recollections, or even the clinical diagnosis. So this is an example of a pedigree chart. It's a common pedigree chart denoting the male and female and the affected individual and the carrier. So at a glance, this offers in a concise manner the state of disorder in the family. So constructing a pedigree with a proper interrogation, though it is a time consuming, but it is ultimately a rewarding. So it forms an indispensable step towards counseling. So after pedigree charting, the third step is estimation of risk. So it forms one of the most important aspects of genetic counseling. It is often called recurrence risk. To estimate it, one requires to take into account the following points. Mode of inheritance analysis of the pedigree or family tree and results of various tests. The fourth step is transmitting the information. So after completing the diagnosis, pedigree charting, and the estimation of risk, the next most important step is communicating the information to the consultant. So while communicating the information to the consultant, certain factors must be keep in mind. The various factors are such as psychology of the patient, the emotional stress under prevailing circumstances, the attitude of the family members towards the patients, the educational, social, and financial background of the family, gaining confidence of the consultants in subsequent meetings during follow-up, ethical, moral, and legal implications involved in the process. Above all, the communication skills to transmit the facts in an effective manner, making them more acceptable and palatable. The last step is management. In genetics, treatment implies a very limited scope. It naturally aims for prevention rather than cure. In fact, for most of the genetic disorders, cure is unknown. So treatment is therefore directed towards minimizing the damage by early detection and preventing further irreversible damage. For example, in phenylketonuria, this is a disorder characterized by the deficiency of phenylalanine hydroxylase enzyme, so which is necessary for the conversion of phenylalanine to tyrosine. So what are the types of genetic screening? So in genetic screening, we are mainly concentrating on carrier identification, prenatal diagnosis, newborn screening, forensic screening. So carrier identification, it is useful in the diseases like sickle cell anemia. In prenatal diagnosis, we can diagnose the child with birth defect or any congenital anomalies. The newborn screening also same like trisomy 21, any neural tube defects like spina bifida can be detected. In forensic screening, the paternity screening, which is important in the marital life. Then applications of genetic counseling. So what are the areas or what are the fields we can apply this genetic counseling? So genetic counselors work with people concerned about the risk of an inherited disease or condition. So these people represent several different populations. So the different populations are categorized into prenatal genetic counseling, pediatric genetic counseling, adult genetic counseling, and cancer genetic counseling. So in prenatal genetic counseling, there are several different reasons a person or a couple may seek prenatal genetic counseling. So if a woman is of age 35 or older and pregnant, then there is an increased chance that her fetus may have a change in the number of chromosomes present. So changes in the number of chromosomes may lead to mental retardation and birth defects. So when to see a prenatal genetic counselor? So if the client is worried about a genetic condition or a disease that runs in the family, or having a child who is affected with a genetic condition, and you're thinking about having another child in the future, so having family members with an intellectual disability or birth defects, or having a history of infertility or pregnancy losses, miscarriages or stillbirths, or the client is concerned that the health or lifestyle poses a risk to the pregnancy, or the client is concerned about the risks to the pregnancy associated with increasing parental age, or the client receiving an abnormal prenatal screening or ultrasound results, or concerned about that she is at increased risk of being a carrier of genetic condition because of their ethnic background, or the client is pregnant and the baby has been diagnosed with a birth defect or genetic condition, or she might have taken a medication or drug during pregnancy, or being exposed to a chemical or radiation, which might cause a problem for the baby. So these are the reasons a client who seeks a prenatal genetic counselor. So what are the diagnostic tests available in the prenatal and the postnatal period? So in the prenatal diagnosis, we are offering screening services like blood sampling, ultrasonography, amino synthesis, and chorionic Villus sampling. So in postnatal period, physical observation, ECG, and ultrasound of the heart. So prenatal genetic counseling. So prenatal tests that are offered during genetic counseling include level 2 ultrasound, the maternal serum alpha fetoprotein, chorionic Villus sampling, and amino synthesis. So level 2 ultrasound. So it is a detailed ultrasound surveying about the fetal anomaly for birth defects. The ultrasound is limited for structural changes in the anatomy and cannot detect the changes in the chromosome number. So level 2 ultrasound only reveals the fetal anomaly, not the chromosomal abnormalities. The maternal serum alpha fetoprotein. So what is alpha fetoprotein? So alpha fetoprotein is a protein that is normally produced by the fetus liver. So alpha fetoprotein is present in the fluid around the fetus, that is amniotic fluid. A small amount crosses the placenta and moves into the mother's bloodstream. So as the baby grows and produces more amount of alpha fetoprotein, the amount in the mother's blood increases. So between the weeks of 15 and 20s of pregnancy or gestation, a maternal serum alpha fetoprotein screen may be offered. It is usually as a part of set of tests which screen for genetic problems called the QUAD screen. So positive alpha fetoprotein levels are most often the result of a miscalculation in the age of the fetus, either maybe a wrong date or due to multiple fetuses in the womb, twins or triplet pregnancy, with each producing alpha fetoprotein. Chorionic Villus sampling. So in chorionic Villus sampling is a prenatal test in which a sample of chorionic villi is removed from the placenta for testing. The sample can be taken either cervical, that is transcervical, or from the abdominal wall, transabdominal. The test can be done as early as 10 weeks of pregnancy. So chorionic Villus sampling can reveal whether the baby has a chromosomal condition such as Down syndrome, as well as other genetic conditions such as cystic fibrosis. The last test is amino synthesis. So amino synthesis is a prenatal test in which a small amount of amniotic fluid is removed from the sac surrounding the fetus for testing. The sample of amniotic fluid is removed through a fine needle inserted into the uterus through the abdomen under ultrasound guidance. The fluid is then sent to a laboratory for analysis. Different tests can be performed on a sample of amniotic fluid depending on the genetic risk and indications for the test. So amniocentesis is performed to look for certain types of birth defects such as Down syndrome, a chromosomal abnormality, that is trisomy 21. The next category is pediatric genetic counseling. So families or pediatricians seek genetic counseling when a child has the features of an inherited condition. Any child who is born with more than one defect, mental retardation, or dysmorphic features has an increased chance of having a genetic syndrome. So a common type of mental retardation in males for which genetic testing is available is Fragile X syndrome. In this syndrome, the child will be having an intellectual disability, delays in milestone. So adult genetic counseling. So adults may seek genetic counseling when a person in the family decided to be tested for the presence of a known genetic condition, or when an adult begins to exhibit the symptoms of an inherited condition, or when there is a new diagnosis of someone with an adult onset disorder in the family. In addition, the birth of a child with obvious features of a genetic disease leads to diagnosis of a parent who is more mildly affected. So genetic counseling for adults may lead to the consideration of pre-symptomatic genetic testing. Cancer genetic counseling. So a family history of early onset of breast, ovarian, or colon cancer in multiple generations of family is a common reason a person would seek a genetic counselor who works with people who have cancer. While most cancer is not inherited, there are some families in which a dominant gene is present and causing the disease. So a genetic counselor is able to discuss the chances that the cancer in the family is related to a dominantly inherited gene. The counselor can also discuss the option of testing for the breast and ovarian cancer genes. So genetic counseling ethics. So there are certain ethics to be followed during genetic counseling. The first and foremost thing is respect the right of the individual. Then approach the client in a non-directive manner. Then keep the privacy of the individual and family, and maintain the communication between the counselor and his or her client. So what are the ethical issues in genetic counseling? So code of ethics. Beneficence are the promotion of personal well-being in others. So the genetic counselor is an advocate for the person being counseled. Non-maleficence is the concept of doing no harm to a person. Autonomy. So autonomy is recognizing the value of an individual, the person's abilities and point of view. So the important aspects of autonomy are truthfulness with persons, respecting confidentiality, and practicing informed consent. So justice is providing equal care for all. Preparation. So the patient should be apprised of possible outcomes and given the opportunity to discuss their feelings prior to undergoing the genetic test. So the process of adequately preparing an individual for genetic counselors is called informed consent. Aftercare. So person must be provided access to competent counselors and therapists. Such professionals can assist in processing the feelings and reactions that may emerge as a result of receiving the findings of genetic test. Complications. So the complications that arise from the process of genetic counseling are most commonly mental and emotional. So individuals and couples who have received genetic counseling of experience mental changes such as depression and anguish when they receive unfavorable results about the test. So depending upon the condition, personal preferences and situation, persons may elect to continue with the pregnancy that is likely to result in a child with one or more abnormalities. So terminate a pregnancy or select a different partner or decide not to have children. The wide spectrum of severity in some diagnosable genetic disorder, the treatability of some diseases, the possibility of diagnosing twins where one is affected and the other is healthy, claims that the practice of mid-trimester abortion creates a precedence of pediatric euthanasia, selective abortion, and decisions about treatment of handicapped newborns with the involvement of eugenics. So the common ethical problems faced by a counselor. So the directive methods, counselor has a positive influence on the counseling decision. In non-directive approach, the counselor is left in an unbiased manner and leaves the whole decision to the counselor. So these are the common ethical problems faced by a counselor. So role of a nurse in genetic counseling. So what is the role of the nurse? The nurse has to guide a woman or couple through prenatal diagnosis and helping the parents make decisions in regard to abnormal prenatal diagnostic results. Then assisting parents who have had a child with birth defect to locate needed service and support, and providing support to help the family deal with the emotional impact of a birth defect. Coordinated services of other professionals such as social workers, physical and occupational therapists, psychologists, and dietitian. Nurse as a genetic counselor. So the important role as a nurse, she has to coordinate with the other team members also. The main thing is important role in follow-up, clarifying the information, and providing continuous support to the grieving process as appropriate. Helps to decrease the risk of transmitting the disorder, and discuss along with the genetic counselor and family members on alternative arrangements in adoption, artificial insemination, surrogate pregnancy, prenatal diagnosis with selective abortion, prenatal treatment, curative treatment, gene therapy, and fetal surgery. And the nurse has to check with the government policy for information and resources regarding neonatal testing required and the state regulations on genetic testing and research. Be aware of associated professional responsibilities, including informed consent, documentation in medical records, medical releases, and individual privacy of information. So to conclude, genetic counseling enables the couples or affected individual to make decisions about a future pregnancy. It helps the affected individual to educate and cope with the disorders with minimal clinical problem. Therefore, genetic counseling is done in an objective manner so that any treatment selected remains the personal choice of the individual involved. Many diseases have genetic root. The genetic screening is an essential issue in most stages of the life. So genetic counseling aims to bridge the gap for people between the genetic field complexity and their life. Thank you.